just that easy.
Call 265-1100. That's 265-1100.
Holly Robinson Pete is in the J-HUD hot seat. Have you ever sent a sexy text to the wrong person?
My son and my husband have the same name, so he was like, Mom, why you send me pictures of your butt?
Sponsored locally by TVFCU.
There are a lot of numbers that you probably know. The first phone number you had as a kid growing up, your children's birth dates, your social security number, maybe even your credit card number by heart. But this morning we want to focus on a different set of numbers that you need to know, and perhaps you don't. It happens to be Stroke Month here across the country, which means a visit from us from Scott Rowe with Encompass Health. Next to him is Beth Wright, who's with the American Heart Association. I stumbled a bit through that because I wanted to get to the meat of the matter, which is the numbers that we really all should know. So good to see you both.
Thank you. Thanks
Good
for having
to
us.
be here.
The numbers are what, Scott? What do we need to know? Or Beth, either one.
Well, your optimal blood pressure would be 120/80. That's what our goal is, and you can obtain that through healthy eating, exercising, no smoking, no vaping, getting a good night's sleep, just an overall healthy lifestyle.
Okay, so blood pressure you need to know. Heart rate, do you need to know your resting heart rate? Is that relevant in the world of heart health and stroke?
You go ahead.
Blood pressure is probably really the more important thing to really be aware of.
Okay.
And then probably more after that, lifestyle. As Kim said, no vaping, no smoking, things like that, healthy diet, those are more important things.
So the two of you come together, the American Heart Association and Encompass, because really a stroke is a heart attack that goes to your brain. Is that a layman's way of putting it?
That's exactly right, yes. And it is something that really requires immediate medical attention, and that's kind of one of the things that we really focus in working with the American Heart Association on, is just providing education to the community about how important it is to know those warning signs and to take immediate action.
So you are the community outreach coordinator?
Community impact director.
Community impact director.
Yeah.
So the educational component of this, I guess, is first and foremost for you at how to get us to realize what we need to know.
Yes, it's pretty scary because a stroke can happen to anyone at any age. In fact, 1 out of every 4 adults over the age of 25 will suffer a stroke in their lifetime.
Wow.
So it knows no age, no race, no gender. So it's just, knowing your numbers and regularly monitoring your blood pressure with your healthcare provider is very, very important.
So is there a genetic component to this? If stroke's running your family, are you more inclined to have one, or can lifestyle changes alone prevent it?
It's a little bit of both. Yes, it can run in the family. It can be something that can be genetic, but knowing that there is that genetic component, knowing that you have that in your family, it's even that much more important to control the things that you can control.
Right.
We can't control other risk factors like race or age, but we can control things like our diet, our blood pressure, our activity level.
Once upon a time, there was a buzzword when you would talk about stroke awareness and signs, and that was FAST. Is that still the thing to remember?
Still very much so.
What does it stand for?
So when we look at FAST, we look at F stands for face. When we're talking about any kind of signs with a stroke, typically we're looking at affecting one side of the body. So with the F with the face, it's looking at potentially drooping with the face. An interesting kind of thing that the American Heart Association has done through stroke.org, you can actually go on and take a picture of yourself, a selfie, and it will show you what a stroke would look like if you had a droop with your face. Because for some it's kind of hard to imagine, but just kind of gives you something creatively, something to look at to know what that would look like. The A stands for arm, so that's looking at any kind of weakness on one side of the body, particularly the arm. It could be the leg as well. Sometimes people even describe it as something as simple as feeling numb on one side or just slightly weaker on that side. Okay. S stands for speech. So that could be having difficulty with speech, so slurred words, or it could be something like having difficulty finding your words, knowing what you want to say but not being able to get the words out.
Okay.
So, and then T, the final part of the FAST, is time. So time is of the essence. If you have any of those warning signs, that's when it's time to call 911 or immediately get to a hospital where you can get care for that.
So a key thing that I think you just said is any one of those warning signs. They don't have to all be visible. If any of those are there, then hurry and call
Exactly.
for help. Okay.
Exactly, most definitely.
Now, at Encompass, y'all are a hospital care for stroke recovery, right? But you
Correct.
specialize in really rehabbing well.
Exactly. Yeah. So when patients have suffered a stroke and they've been in the acute care hospital, they come to us afterwards to begin their recovery. And recovering from stroke is definitely a months and sometimes a year-long thing. But our services kind of help them get started on the right foot and really jumpstart the recovery. A matter of fact, information from the American Heart Association has suggested that for those people that can, getting rehabilitation in a hospital, an inpatient rehab hospital, is the preferred method for rehab to start with.
And Beth, within the American Heart Association, those kind of preventive tips that I'm sure you hope we'll all embrace. I guess it's a good time of year, the weather's good, even if what you choose to do is exercise by hitting your neighborhood pool.
Exactly.
Do something to be active.
Yes, just get moving, no smoking, no vaping, healthy lifestyle, whole foods, and just, get a good enough night's sleep and just really live that whole lifestyle.
And not to be overly stereotyping here, but with the vaping world, you often tend to associate that with younger people. And I guess that's a concern since a stroke can happen
to anyone at any age.
age.
Yeah, that's the really concerning thing in healthcare is that we're seeing more and more younger folks experiencing stroke. And thinking, and I think with a lot of people, it's, well, that's just something that happens to older people, and that's definitely not the case, especially if there is a genetic component or if there's other things that could set them up for stroke.
You mentioned stroke.org as a website. I'm guessing the American Heart Association also has lots of educational pieces on the website as well.
Exactly,
And
yes.
then at Encompass, if someone needs to come to you for rehab, can they self-refer or does a doctor have to send them to you?
Yes, they can. They can reach out to us. There's information on our website about how to reach us by phone, or they can email us through the website.
Okay, then here's your information for both of them, but stroke.org is one website to remember. Of course, you can always Google the American Heart Association and then encompasshealth.com, as you heard Scott say. Thank you both so much.
Thanks for having
120
us.
over 80.
Yes, optimal.
Is your backyard one of your favorite places to be? At Superior Fence and Rail, we install beauty, privacy, and safety. Call today for our 12-month same-as-cash offer. There's no need to wait. Superior Fence and Rail is Chattanooga's fencing company that you can trust.
Outdated brick homes need help, and no one knows brick homes like Refined Home Finishes, your local brick experts. Their crews use high-quality lime washes to create modern masterpieces that age beautifully and won't peel or flake. If you need the